So who are the patients with Crohn's that best respond to my treatment approach? So they're just like you. They had pain, they had diarrhea, they had constipation, they went to their doctor, they did all the blood tests, they got sent to a GI specialist, probably multiple GI specialists. They had more testing done, including endoscopies, CT scans, they found some inflammation. Everything pointed to the best explanation of Crohn's. So they accepted that diagnosis at first and they got their treatment. They went on steroids, they ended up on biologics, Humira, Skyrizi, Stelara, and Entyvio. They tried one or multiple, and still, despite the diagnoses, despite the treatments, despite seeing multiple specialists, they're still suffering, they're still having their symptoms, and they're still kind of ruining their life. So they kept looking for something different, something that might explain what is going on and also actually treat it. And these patients do typically have some things in common. A lot of these patients had a history of back pain at one time. A lot of these patients will get back pain during their flare-ups. And a lot of these patients had some symptoms down into their leg. A lot of people have hip and groin issues, knee pain, or even pain down into their foot that was diagnosed at one point as plantar fasciitis. Some of these people have numbness and tingling running down their leg. A lot of these patients realize that activities like walking, standing, sitting in a car actually bother their symptoms more, so they're seeing positional changes affect their symptoms. And these patients are the patients that respond so well to my treatment. My approach is looking at your spine to see if the area of your spine that innervates your intestines, your stomach, your organs could be the underlying cause, because if so, not only can we improve your symptoms, but we can actually treat and cure the underlying problem that was very likely misdiagnosed from the beginning. And I understand that this is different information than anybody else out there is going to give you. I don't expect anybody out there to take my word for it. But what you can do is you can see patients that have gone through this process, patients that talk about their healthcare journey, patients that say everything that I'm saying right now that they went through, and then they found me and the results that happened from this simple treatment. If you look for my podcast, which is available on YouTube and Spotify, The Spinal Truth Show, you can hear directly from these patients, hear about their journey, hear about their symptoms, and hear about the results that they got, because I'm sure there's a lot of other people out there just like them that is going through the same journey, and their life is getting turned upside down by frequent bowel movements, pain, inability to eat and enjoy food or alcohol, all of the same symptoms that these patients had. So if you want to know more, the information's out there.